Hello everyone, welcome to another episode on Your Mom Talks. Cancer of the cervix is the fourth most common cancer found in women worldwide. According to the latest WHO reports, more than 6.2 lakh women were diagnosed with cancer of the cervix last year, and there were more than 3.2 lakh deaths because of this cancer. In India, cancer of the cervix is the second most common cancer found in women. And there are about 500 million women in the age group of 15 years and older. And these are the women who are at risk of developing cancer cervix. According to the latest reports in our country also, there were more than 1.2 lakh new cases diagnosed of cancer cervix, and there were about 70,000 deaths. One woman is dying of cervical cancer every 8 minutes in our country. No, I'm not trying to scare you. I'm just trying to shake you up. आपको डराने के लिए नहीं, आपको समझाने के लिए मैंने ये नंबर्स शेयर किए हैं. Cancer of the cervix is like an epidemic in our country, and we need to control it, and we need to control it fast. तो अब कैंसर सर्विक्स से कैसे प्रिवेंशन की जाए? Now, if you know the cause of a disease, then it is very easy to control the disease. आप cause को control करो, disease अपने आप control में आ जाएगी. So, what is the cause of cancer cervix? आपको जान के हैरानी होगी that cancer cervix is caused by a virus. Yes, you heard it right. Human Papilloma virus is the cause for more than 90% of cervical cancer cases. अब ये HPV virus क्या है? I'll just tell you a little bit more about it. There are more than 200 types of HPV types, जिनमें से about 15 of them are high-risk HPV types. These high-risk HPV viruses are the ones which cause most of cancer cervix, and not only cervix, they also cause cancer of the anus, the penile, vaginal as well as throat cancers. तो इनमें से जो HPV 6 और 11 है वो लो रिस्क है, पर वो जेनिटल वॉर्ट्स करता है, मस्से जिसको हम कहते हैं. और HPV 16 और 18 दे आर एसोसिएटेड विद ऑलमोस्ट 70% ऑफ कैंसर सर्विक्स केसेस. Now, HPV infection is the most common sexually transmitted infection in the world. 4 out of 5 men or women would have had this infection once in their lifetime. जब HPV infection होता है तो the person does not come to know about it because there are no symptoms. अब जब symptoms ही नहीं है तो patient will not seek advice from any doctor and will not be taking any medicine for it. But then there is good news that most of the people will clear this HPV infection in the next 1 to 2 years. 90% of people clear their HPV infection because of their body immunity on their own. They clear it in the next 2 years. अगर ये इन्फेक्शन परसिस्टेंट हो जाती है, जैसे कि अगले 3, 4, 5 साल में भी the body is not able to clear this virus, then this can lead to precancerous lesions of the cervix, जो कि अगले 10 से 15 साल में कैंसर बनते हैं. तो आपके पास एक विंडो ऑफ अपॉर्चुनिटी है ऑलमोस्ट क्लोज टू 10 to 15 years, जिसमें कि आप कैंसर, ये HPV इन्फेक्शन का कैंसर में परिवर्तन होने तक आप रोक सकते हो. और वो कैसे रोक सकते हैं? बाय स्क्रीनिंग. तो अगर आप पैप स्मीयर एवरी 3 years करा रहे हो तो अर्ली डिटेक्शन प्री कैंसरस लीजन्स की हो जाएगी. पर हम तो डिजीज़ के रूट कॉज पे जाना चाह रहे हैं. सो वी आर टॉकिंग ऑफ प्राइमरी प्रिवेंशन थ्रू वैक्सीनेशन. So we have a vaccine against HPV virus. So HPV vaccination is given ideally to girls between 9 to 14 years of age. In girls में 2 doses are given. The second dose is anytime 6 months to 12 months after the first dose. Now if the girl is more than 15 years of age, or if she's immunocompromised like say HIV positive, then 3 doses are given at 0, 2 and 6 months. So less than 15, 2 doses, more than 15 years, 3 doses. Now, there is no booster dose which is required. Studies have shown that the antibodies after initial vaccination are very high, and they remain high for the next 15 to 20 years. So there is no need for any booster dose. The injection is given intramuscularly in the deltoid or your upper arm. The side effects of the vaccine are very minimal. Only local side effects in the form of swelling or redness at the injection site, or maybe some nausea or slight fever may happen. But no major side effects have been seen with this vaccine. Now, this vaccine has been in the market. Over 1 million of doses have been given to young girls and women, and there have been no serious side effects ever reported. Now, what are the vaccines which are available? We have quadrivalent vaccines and we have nanovalent vaccines. Quadrivalent vaccines, quad means 4. So the quadrivalent vaccines protect us against 4 types of HPV. HPV 6 and 11, which cause genital warts, and 16 and 18, which are responsible for most of cases of cancer cervix. So you have Gardasil 4. The approximate cost of this vaccine is close to 4,000. And we have Cervavac. Now, Cervavac has been manufactured in India by Serum Institute of India. So it is definitely cheaper. The per dose cost is close to 1200 to 1500 rupees. Now, then there is a nonavalent vaccine which comes by the name of Gardasil 9. Now, this protects against those 6-11, the ones which cause warts, 16-18 plus 5 more high-risk HPV types. So in total, it is actually protecting against 9 HPV types. The cost is obviously more expensive. Per dose, it comes to about 10,000 rupees. Now, the efficacy of all the vaccines is similar. It's not that Gardasil 4 is better than 9 or 9 is better than 4 or Cervavac is in any way inferior to Gardasil. So all the efficacy of all the vaccines is similar. So you can use whichever vaccine that you want. Now, there are some myths which are associated with HPV vaccine, which I want to deal with in this video. Myth number 1, that my girl is just 9-10 years. Now, they are not sexually active at this age. Why should I give a vaccine to my young girl? Now, there are 2 important reasons for this. The most important reason is that the earlier the vaccine is given, the antibody response is much higher. There have been various studies in which they have compared the antibody level when the injection was given at 9 years, 10 years, 11 years, 12 years, and they found that the maximum level of antibodies is reached when the vaccine is given to younger girls. So by the time they are sexually active, they would have a good amount of antibodies in them to protect them against HPV infection. Also, according to latest IARC report of 2024, IARC is International Agency for Research on Cancer, the percentage of 15-year-old males in India who are sexually active is 2.5%. And the percentage of 15-year-old girls who are sexually active is 8%. And the mean age when the girls are becoming sexually active is between 16 to 17 years. So we really need to catch them young if we want to protect them from getting HPV infection. Then myth number 2, I'm getting my pap smear every 3 years. Why do I need a vaccination? Now, we have to remember that pap smear is a screening test. Screening test meaning that once the disease is there in the cervix, it will catch that disease early. It cannot prevent the disease from happening. But the vaccine, it prevents HPV infection from happening. It's a method of primary prevention. So, vaccination and screening, they are not complementary. You can't replace one with other. They are supplementary to each other, meaning thereby that vaccination and screening go hand in hand. So even if you are vaccinated, regardless of your vaccination status, the screening also has to continue. So please do not stop screening if you are vaccinated. And if you are you are getting your screening done, that should not stop you from getting vaccinated. So it works both ways. They are supplementary to each other. Then myth number 3, this vaccine causes premature ovarian failure. Now, absolutely not. This vaccine has been given to millions of females and they have been studied over time, and this vaccine in no way causes premature ovarian failure. Myth number 4. Now, when HPV is such a common sexually transmitted infection, and I would have had it sometime in my lifetime, then why do I need to get myself vaccinated? I would already have antibodies from my natural infection. That is not so. The natural infection will definitely lead to formation of antibodies, but that antibody response is not as good as the response you get after a vaccine. So the immunity system or the immune response is much more robust after the vaccination rather than after a natural infection. Myth number 5. This vaccine is not safe. I am not going to give it to my young girl. There are no safety concerns regarding this vaccine. All the reputed bodies worldwide like WHO, CDC, everybody recommends that this vaccine should be given to young girls, and no major side effects have been reported from anywhere globally for this vaccine. So please be safe and vaccinate. That's all for today. Thank you. If you like my video, please subscribe to Your Mom Talks.